Let's start with the class, and this is class is going to be the orthopedics class. Sir, orthopedics में if see the bone का part, basic part, we are going to talk about basic anatomy part right here, sir. Basic anatomy part में यहाँ पे आया epiphysis, फिर आया metaphysis और फिर आया diaphysis. Metaphysis और epiphysis के बीच में आती है सर हमारी growth plate. Growth plate, and this bone is covered by the layer called as periosteum. पेरियोस्टियम का काम क्या है? न्यूट्रिशन वगैरह प्रोवाइड करता है, देखता है, प्लस नर्व एंडिंग्स होती हैं, प्लस यहाँ पे प्रोटेक्टिव फैक्टर्स प्रेजेंट रहते हैं. प्रोटेक्टिव फैक्टर्स प्रेजेंट रहते हैं. सो लेट्स वन बाय वन टॉक अबाउट द इंपॉर्टेंट टर्म्स व्हिच वर आस्क्ड इन द एग्जाम. सो माय डियर लेडीज एंड जेंटलमैन, वेलकम बैक टू द फायर एड बाय कॉन्सेप्चुअल मेडिसिन. ठीक है. पेरियोस्टियम, पेरियोस्टियम इज नथिंग बट अ आउटर कवरिंग ऑफ द बोन. What is the function of periosteum? Protect the bone against tumor and the infection. ठीक है. ट्यूमर और इन्फेक्शन के खिलाफ जो लड़ाई लड़ता है बोन की, that is what sir your periosteum. Periosteum. And next thing is 𝗲𝗵 fiber. What this 𝗲𝗵? This is bone, and this is periosteum. Okay, let's suppose this is periosteum. Now periosteum is connected to the bone with the help of green fiber. This is called as 𝗲𝗵 fiber. And you know, all of the things are made up of type 1. Most abundant collagen in the body is what's a type 1 collagen. So periosteum, outer covering of the bone, protect against tumor and infection. One tumor basically we are going to talk about. Okay. Next, talk about the osteomalacia. Osteomalacia. Vitamin D deficiency in bachcha log is what's are your rickets. In adult it is osteomalacia. Now what things are you going to see? What is happening? Sir, there is a loosening of the zones in the bone, plus there will be a softening of the bone due to decrease in the minerals. They will look like a fracture, but they are not a fracture. They look like a fracture, but they are not fracture. This is called as pseudo fracture, or in other language we call that as loser's zone. We call that as what, sir? Your loser's zone. Loser's zone. Loser's zone. Loser's zone. Done, sir? Now, sign and symptom like bone pain, muscle weakness, the patient is going to tell you. On examination, you will see the alkaline phosphate. When the alkaline phosphate levels are high, always remember your vitamin D is, the bone demineralization is happening. Vitamin D is less. Alkaline phosphate means the osteoclastic activity is going on. Bone resorption is going on more. The bone resorption means bone toot raha hai, so your serum calcium level also will be high in this, sir. Coming to the osteoporosis. Now, what is happening in the osteoporosis? My dear friends, in the osteoporosis, you will see the bone is porous. The bone is porous. Andar se khurduri bone hai. That is also easily breakable bone. And also on the X-ray, what you are going to see on the vertebra, you are going to see fish mouth vertebra. Fish mouth vertebra. Fish mouth vertebra. So this bone is also prone to easy getting fractures. Now, sir, on DEXA score, you are going to measure the T score, and here it is less than 2.5 is again another previous year question. Again another previous question. The DEXA score, it is here it is going to be less than minus 2.5. Now, osteopetrosis. Now, what is happening in the petrosis? Sir, one is osteoclastic activity, one is osteoblastic activities. ऑस्टियोक्लास्ट का काम होता है बोन को तोड़ना और ऑस्टियोब्लास्ट का काम होता है बोन को बनाना. Here in the osteopetrosis, what is happening? The osteoclasts are not working. These osteoclasts are not working. Chalo. And osteoblasts, which we are talking about, osteoblasts are working, overworking. And if osteoblasts are working, only bone formation is there. That means more calcium is there. More calcium, more mineralization. That means bone is now looking more white. White like a marble. That is why this is also called as marble bone disease. That is why this is called as marble bone disease also, sir. So if you want to compare right here, sir, you can see right here, sir. This is healthy bone. You can see the cortex are more white and it is less white from the inside part. But here in the osteopetrosis, which is also called as a marble bone disease, here osteoblasts are overworking. Because of that, there is an extra mineralization. Now, my dear friends, because of extra mineralization, this bone is extra hard also. And extra hard things are also easy to break. So this is also getting break down easily. Osteogenesis imperfecta. the gene deficiency coli-A1, coli-A2 genes are then which are getting faulty right here, sir. ठीक है. Now blue sclera, multiple bone fracture, hearing loss, SNHL, sensory neural hearing loss, plus your teeth will be getting what, sir, degenerated, or you can say malocclusion of teeth will be there, sir. Remember, so blue sclera, multiple fracture and hearing loss will be there, sir. हाँ कोई नहीं, तुम गिफ्ट दे देना, मैं वो भी पहन लूंगा, ठीक है. चलो डन. नाउ सर, blue sclera, multiple fracture and your hearing or aid will be there, sir. Done. Osteogenesis imperfecta, ठीक है. Osteogenesis imperfecta. Now coming on to the Paget's disease. Paget's disease. The pathological defect is that it is becoming porous. अंदर से खुरदुरा होता जा रहा है. That is pathology. And most common organism which is affecting the bone is Staphylococcus aureus. Done, sir? Chalo. Now, sir, Paget's disease is done. Now, Paget's disease is what? Now, the old bone is replaced by the new bone, sir. Old bone is always replaced by the new bone. Now, this replacement is getting faulty. So, what is happening right here? The disease which deserves with the replacement of old bone with the new bone is Paget's disease. This is what, sir, your Paget's disease. Now, let's talk about this. Appearance. Now, there are the three stages of the Paget's disease. What are the three stages of the Paget's disease, my dear friends? Lytic stage, mixed stage, and sclerotic stage. Lytic stage, mixed stage. Here we are having three stages. What are the three stages, my dear friends? Number one is lytic stage, where only bone is breaking down. Where only bone is breaking down. The only bone is breaking down. Breaking down matlab only clasts are working. Mixed stage में bone break and formation है, matlab clast plus blast both are working. Sclerotic stage में only bone formation, where only blast is working. So here the cotton wool skull is a feature, and cotton wool skull is seen in mixed stage, my dear. Cotton wool skull is seen in mixed stage, sir. Mixed stage, sir. And drug of choice for this Paget's disease, again, bisphosphonates we are going to give. Other finding in the osteopetrosis, which was marble bone diseases, sandwich vertebra. Sandwich is also white sandwich. Done, sir. Now, rugged jersey spine is a feature of hyperparathyroidism, and picture frame vertebra is another feature of Paget's disease. These are the extra finding. Plus, in the Paget's disease, you are going to see grass blade sign. You can see or flame sign. Grass blade sign or flame shapes. Glass blade या फिर अग्नि जैसा साइन भी आपको देखने मिलेगा. अग्नि जैसा साइन देखने मिलेगा. Done, sir? चलो. Now, sir, coming to this achondroplasia, sir. Achondroplasia. It occurs due to the mutation of the fibroblast growth factor. Bone density बढ़ेगी तो fragile ही हो जाएगा ना यार. ज़्यादा कैल्शियम एक्स्ट्रा मिनरलाइजेशन होगा तो वो फ्रेजाइल बोन हो जाएगा. Now there is a gene FGFR3, autosomal dominant, most common cause of dwarfism. Now what is happening right here? The trunk is normal but the limbs are short. Plus the hands are like this. This is called as trident hand or starfish-like appearance. Trident hand or starfish-like appearance. Achondroplasia. Okay. Now, sir, on X-ray you are going to see the champion glass pelvis. On X-ray you are going to see the champion. The achondroplasia, most common cause of dwarfism. FGFR3 gene mutation is there. Trunk is normal, limbs are short. Plus हाथ में आपको trident या फिर starfish-like appearance देखने मिलेगी. Plus आपका X-ray pelvis पे आपको champion glass pelvis देखने मिलेगा. Done हो गया? Done. चलो. Now, sir, osteomyelitis. It is an infection of bone. Sir, 99% of the time in orthopedics, the causative organism is going to be the Staphylococcus aureus. Most common rose is hematogenous. Now, this is further divided into two, acute and chronic. Sir, acute and chronic, you will see acute is most commonly seen in the cute कौन है बच्चे. और most commonly vascular part involved होता है. Most common vascular part in the bone is going to be the metaphysis. So, metaphysis is going to be affected. जब ये बहुत ज़्यादा prolonged हो जाता है, 2-3 महीने ऐसा रहता है, नहीं treat हो पाता है, after that what will happen, sir? There will be a conversion of acute osteomyelitis to the chronic osteomyelitis. And now, along with the new bone, you are going to see the dead bone, and dead bone is called as sequestrum and new bone is called as involucrum. The new bone भी बनने लग जाएगी dead, but out of these two, which is a hallmark, सड़ी गली bone, that is called as sequestrum. Sequestrum. Done, sir? Now coming to the Brodie's abscess. Again, an infective organism, Staphylococcus, is coming. It is causing a pus, and pus is looking gray inside the bone. You can very well see this area. Gray area inside the bone is Brodie sepsis. Ankylosing spondylitis. Sir, this is an inflammatory arthritis. What is happening? The joint space between the two vertebrae, they are decreasing. They are decreasing. So remember, they are decreasing. They are fusing with each other. They are fusing with each other. So they are looking like a bamboo. So remember, here is a bamboo spine. Plus the gene associated right here is 𝗏𝗵27, ankylosing spondylitis. Now coming to the next topic called as bursitis. Bursitis. Before that, some questions are popping for all of you. Please answer the question, sir. Question number 1. Sir, sandwich vertebra is seen in. Sandwich vertebra is seen in. My first question for all my dear broad-minded medicos. Please. Sandwich vertebra is a feature of. Sandwich vertebra is seen in. My first question. Osteopetrosis. Picture frame vertebra is a feature of. Paget's disease. Cotton wool skull is a feature of. Paget's disease. Outermost covering of the bone is called as periosteum. It is called as periosteum. And periosteum is connected to the bone with the help of 𝗏𝗵𝗍. Very, all the questions are correct. Now let's talk about this bursitis. What is bursitis? There are fluid-filled pad, and with the age or with the inflammation, this fluid-filled pad degenerate. Because of degeneration, the two structures are now rubbing against each other, and they are causing the pain and inflammation. So remember, what are the different type of bursitis we are having, sir? First of all, housemaid's knee. The housemaid's knee is having prepatellar bursitis. This is patella, sir. This is patella. और patella से पहले होगा ऊपर की तरफ prepatellar. क्लर्जी मैन हमेशा झुक के नीचे रहता है, नमस्ते करता रहता है, ठीक है. चल सर, इंफ्रापटेलर बर्साइटिस. स्टूडेंट्स एल्बो, बच्चे हमेशा पढ़ते रहते, पढ़ के यहाँ पे हो जाता है अलिकनान बर्साइटिस. वीवर्स बॉटम, इशियल बर्साइटिस. टेलर में एल आता है, लेटरल बर्साइटिस. लेटरल एपिकॉन्डाइटिस में टेनिस एल्बो. मीडियल एपिकॉन्डाइटिस में गोल्फर एल्बो. कल भी पढ़ाया था सर आपको, कल भी पढ़ाया था सर ये बात. अब जरा सा एमसीक्यू का वाइवा दे दीजिए सर. स्टूडेंट एल्बो. स्टूडेंट एल्बो इज अ फीचर ऑफ. स्टूडेंट एल्बो में क्या देखने मिलता है? दिस इज योर प्रीवियस ईयर क्वेश्चन. दिस इज योर प्रीवियस क्वेश्चन. वाज आस्क्ड इन द एग्जाम, माय डियर फ्रेंड्स. स्टूडेंट्स एल्बो, ओलिकनॉन. सर, lateral epicondylitis, again exam question. Lateral epicondylitis. Laterally will play tennis, sir. Clergyman, sir. Clergyman. Next question is clergyman. Clergyman, it is going to be very nice, very good, absolutely correct. Clergyman, it is going to be clergy. Infrapatellar bursitis. Done and dusted, sir. Let's talk about the dislocation, sir. Sir, according to the shape, according to the organs, you will yourself imagine what type of dislocation is going to happen. Like if you have to hit someone with the shoulder, you will mostly use the anterior side. So most common location of the shoulder dislocation is going to be the anterior side, sir. Elbow you have to hit posteriorly. So posterior side, sir. Hip also from the posterior posterior side, sir. Then, sir, knee you'll hit in the anterior side, and patella again to the lateral side, sir. So it is the common dislocation. Now I'll show you the gender neutral image right here, and you will yourself see that how to check which dislocation is happening. So this is a gender neutral image. Sir, what is happening right here? Here your knee is flexed and abducted and externally rotated. So this is Fabber, and Fabber mnemonic is for anterior dislocation. You can see flexed, abducted and externally rotated. This is Fabber, it is for anterior dislocation. The head is coming out, femur head is coming out like this in the anterior side. Now this, if you check, this is flexed, adducted and internally rotated. This is called as Fabber. Fabber is for the posterior dislocation. Clear हो गया फंडा? सबको समझ में आ गया? What I try to tell you all. Fabber is anterior dislocation and Fabber is posterior dislocation. You can write C, sir. head of the femur is going backwards. Head of the femur is going backwards, sir. Done and dusted, sir. Okay, chali. Now let's talk about the syndrome and the nerve injuries. Important syndrome and the nerve injuries, sir. If we see right here, sir, cubital, U for ulnar nerve, Guillain canal, ulnar nerve, carpal tunnel syndrome, median nerve, sir. Tinel test, Phelan, reverse Phelan, all those tests we do for this, sir. Now fracture healing as a process. First of all, 0 to 2 weeks hematoma formation is there. 2 to 3 weeks soft callus, then hard callus, then bone remodeling will happen. 2 महीने से लेके 2 साल तक का time लग जाता है. 2 months to 2 years of time it will take. Now, the basic information you need to add in yourself that parathyroid, what it is doing increase in the serum calcium. How? Dietary and tubular absorption of the calcium. What calcitonin is doing, it is decreasing the serum calcium by blocking the osteoclastic activity, sir. This is just add-on you can do to your brain. Now fractures, different type of fractures we have to talk about. First of all, open fractures and closed fractures. So my dear ladies and gentlemen, open and closed fracture is one classification, other is on the basis of the fracture line. If straight line is there, transverse. If linear line is there, linear fracture, oblique, non-displaced, oblique displaced. Spiral fracture is there, green stick fracture is there, then there will be a comminuted. One more fracture is there when bone is cutted into different segment, that is called a segmented fracture. That is called as what, sir? Segmented fracture, segmented fracture. Now let's talk about the complication. Now I have divided this complication into early and the late complication. My dear friends, early complication if we talk about, पहले क्या होगा? सबसे पहले अगर किसी का एक्सीडेंट होता है तो shock can be hypovolemic shock. Neurogenic shock can happen, sir. Early complication. Plus very important early complication is fat embolism associated with the long bone fracture, sir. Then this emboli will lodge and go to lungs, from heart to it will go to lung, and the person can die, sir. And the duration of this is what? 48 hours to 72 hours. Within 48 to 72 hours the person will die. In the deep vein thrombosis, prolonged immobilization is required. In that, at least 6-7 days of time. If prolonged time is mentioned and the patient dies suddenly because of a prolonged bed rest, you will think of a DVT. If within 2 to 3 days the person is suddenly dying, 1 घंटा पहले मरीज बात कर रहा था, 1 घंटे के बाद पेशेंट लुटक लिया, just because of the fat emboli which lodged and going inside the lungs. Third important complication is compartment syndrome. Now what is happening? There is a pain on the dorsiflexion. Why there is a pain on the dorsiflexion and your contracture is like this? This is called as Volkmann ischemic contracture. There is a negative pressure under the skin in the fascia. Because of the negative pressure, there is a necrosis happening. The blood supply is hampered, necrosis is happening. Necrosis is happening, because of that there is an intense pain. Immediately this is a surgical emergency where you will just put an incision and pressure will release. Moment the pressure releases, patient will say you, Dr. Saab, thank you. You are best. So if you want to become best, you need these kind of things in your life, my dear friends. So these are the complications we have divided. Early one is shock, fat embolism and compartment syndrome. Each of them are individual question in themselves only. Now sir, coming to the delayed complication. Delayed complication number 1, if we have to talk about myositis ossificans, where your muscle got trauma, there got a hematoma got calcified. मसल का ट्रॉमा हुआ, ब्लड इकट्ठा हुआ, वहां पे हीमाटोमा बना, हीमाटोमा कैल्सीफाई हो गया, जो एक्सरे पे ऐसा दिखेगा. तो मोस्ट कॉमन मसल टू गो अंडर दिस myositis ossificans is brachialis. Brachialis muscle is the most common muscle to go under this, sir. Now avascular necrosis, most commonly seen with the scaphoid, sir. Most common bone to get fracture is also scaphoid. Most common in the carpal bone it is scaphoid, and avascular necrosis, this is also, sir, scaphoid, also, sir, scaphoid. Now coming to the malunion and non-unions. Malunion means there is a faulty union like this seen with the supracondylar fracture of the humerus, and that is also not an early complication, that is also a delayed complication. Now next is non-union. Now fracture do not unite at all, they are having a gap, and most commonly this is associated with the lateral condylar fracture of the humerus. So these are some early and the delayed complication we have just finished, sir. Now let's talk about all the type of fractures we are having, important type of fracture. First of all, I would love to tell you about the clavicular fracture. So this is the overall most common bone to get fracture. Now this is divided into two. One is unilateral and bilateral, and before that the which site is getting damaged most commonly. So medially this is 3/5 and laterally 2 डंडे होते तो याद रखना 2/5. If unilateral clavicular fracture is there, the treatment is underarm splint. Sling बोल दो. If bilateral is there, the treatment is figure of 8 splint. Figure of 8 splint. Figure of 8 splint is there, sir. Most common bone to get fracture overall, site medially 2/3 and laterally 2/5. Clavicle, remember, if unilateral is there, there will be a underarm sling, okay, or bilateral होगा the figure of 8. Now, sir, let's talk about the neck of humerus. The nerve injury is axillary nerve. Yesterday only we have talked about abduction खत्म हो जाएगी क्योंकि deltoid को सप्लाई कर इसकी मस्कुलोक्यूटेनियस ब्रांच होती है एक्सिलर नर्व की जो हमारे सेंसरी एरिया को सप्लाई करते हैं. दैट इज व्हाई regimental bad sensory loss will be there, sir. Yesterday only we have talked about this, sir. Now neck shaft of humerus, the nerve gone is radial nerve. What will happen after the radial nerve injury? There is going to be the wrist drop, my dear friends. What treatment you are going to offer such patient? You are going to offer a cock-up splint, my dear friends. What is a non-traumatic cause of a wrist drop? In the forensic medicine we have learned, sir. Non-traumatic cause of a wrist drop, sir. We have in the forensic medicine we have learned that. Can you tell me non-traumatic cause? Sir, lead toxicity. Now Colles and Smith are the two fractures which confuses us. So let's us talk about the differences and the similarities. First of all, Colles and Smith, sir, they both are the fracture of distal end of the radius. They both are for the distal end of the radius. Distal end of the radius. Okay, sir? Distal end of the radius. They both are fracture of distal end of the radius. Now the difference is mode of injury and deformities what we are having. Mode of injury, if we see in the Colles, the mode of injury is push falling onto the outstretched hand. In the Colles, it is what, sir? Your flexed hand, like this. If you are falling onto the outstretched hand, the displacement is going to be the outward. The displacement is going to be the outward. Okay? And if you are falling onto the flexed hand, the displacement is going to be the inward. Plus, dinner fork deformity is what you are going to see in the Colles, and garden spades deformity is like this. You can see the hand. This is the feature of Smith fracture. This is a feature of what, sir? Smith fracture. Now coming to the next type of fracture is Barton's fracture. This is again a fracture of distal end of radius. Now this is involving the intra-articular surface. Then scaphoid fracture we were talking about. Sir, scaphoid के अंदर most commonly area affected is anatomical snuff box. Anatomical snuff box के बारे में हम कल बात कर रहे थे. We have talked about the boundaries. We have talked about the content. We have talked about the roof. We have talked about the floor also. Roof and floor also. Now, sir, most common carpal bone to get fracture and avascular necrosis में भी जाता है. If there is a scaphoid fracture, which cast you are going to give? That is also a question. That is what, sir? Your hand holding या फिर glass holding cast. Not hand holding, sorry. Glass holding cast is going to be there. Glass holding cast is going to be there, sir. Okay, done. Now coming to the Rolando fracture. Sir. Intra-articular fracture of base of the first metacarpal. You can see right here, sir. Intra-articular fracture of a first metacarpal. And now this fracture is dividing this into multiple fragments. Okay? And detached with the several fragments. This is called as Rolando fracture. Boxer's fracture is on the fifth meta. Boxer boxing कैसे करता है? Fifth metacarpal का fracture you can very well see. Right? Mallet finger. This is not a fracture of a bone. This is a avulsion of an extensor tendon. Tendon is gone. That is why your finger will drop like this. Sir. Then coming. चल. उसके बाद बात करते हैं supracondylar fracture of the humerus. Supracondylar fracture of the humerus we have talked about. Now we have to talk about the most common nerve involved, artery involved, late complication. Sir, in the supracondylar fracture, the nerve involved is amaru, like a damaru. We have to remember here amaru. Anterior interosseous nerve, medial nerve, radial nerve, and ulnar nerve. Examiner once says ask ulnar नहीं दिया था, medial नहीं दिया था, anterior interosseous नहीं दिया था, medial radial नहीं दिया था, ulnar दिया था. Your answer is ulnar nerve. Your answer is what, sir? Ulnar nerve. Most common artery is brachial. And if you will not do the Dunlop traction use होती है इसके लिए, if you are not applying that properly, there is going to be the delayed complication, and that is going to be the tissue. That is gun stalk deformity. Monteggia and Galeazzi also confuses us equally, sir. Monteggia and Galeazzi also confuses us equally, sir. Now, sir, Monteggia is a fracture of ulna and Galeazzi is a fracture of radius. Now, which ulna? Sir, proximal ulna. And which radius? Sir, distal radius. First difference is clear and similarity is clear to all of you. Sir, Monteggia is a fracture of proximal 1/3 of ulna. Proximal 1/3 of the ulna. And Galeazzi is a fracture of distal end of radius. Now, distal end of a radius is having a supination pronation joint, that is radio-ulnar joint. तो अगर आपके distal end of radius के साथ आपका radio-ulnar joint is getting dislocated, my dear friends, then you have to answer mark as a Galeazzi. And if only radial head is dislocated along with the ulnar fracture proximal part, the answer is going to be the Monteggia. The answer is going to be the Monteggia. Now, my dear friends, let's talk about this shoulder dislocation here now. Shoulder dislocation. See, this is a glenoid cavity, and in this glenoid cavity, there is a head of humerus. So, in the glenoid cavity, there is a head of humerus. So, anterior side, let's talk about anterior side. It is getting dislocated to the anterior side. So, when it is dislocated to the anterior side, there is going to be the damage on the glenoid cavity, plus there is going to be the damage on the bone. The bone is looking like a hill. That is why the damage which is happening on the hill is called as 𝗲𝗵 lesion. And glenoid cavity, जिसके अंदर banking हो रखी थी bone की, this banking lesion is called as Bankard's lesion. So, Bankard's is a lesion on glenoid labrum, and 𝗲𝗵 is a lesion on the posterior part of the humerus, head of the humerus, sir. Now, developmental dysplasia of the hip. Now, your femur is not getting into the 𝗲𝗵 cavity because of the developmental delay. Here we will use a splint called as pelvic harness. The long head of biceps fracture is due to the tendon bicep. Tendon bicep टूट जाती है, पूरा brachialis muscle एक उसकी तरह, you will say नींबू की तरह यहाँ पे इकट्ठा हो जाता है. So this is long head of biceps fracture. Nightstick fracture. आपने कोई डंडा मार रहा, आपने अपना हाथ आगे किया उसको बचाने के लिए, isolated shaft of ulna is getting damaged. Done. Now, Bennett's fracture is a brother of Rolando's fracture. This is again a fracture of intra-articular fracture of a base of thumb. But now, in the Ronaldo, there was several fragments. Here it is single fragment. दो ही टुकड़ों में divide हुआ. पर Rolando multiple टुकड़ों में divide हुआ. This is the difference between Bennett's and the Rolando fracture. Jersey finger. Now, sir, jersey finger में what is happening? There is a rupture of a digitorum profundus tendon. जो मुट्ठी को पूरी बंद करने में help कर रहा था, उंगलियों को बंद करने में, अब नहीं हो रहा. तो whenever we are clinching that, you will see one finger is not able to close, and that is a affected part because digitorum profundus is gone, sir. Gamekeeper thumb. In gamekeeper thumb, there is no bone injury, but there is an injury to the ulnar collateral ligament. Bumper's fracture. The bumper fracture में there is a fracture of a lateral tibial condyle where fibula is also present. Now, this fracture will lead to foot drop. Why? My question is why? Can anyone answer why this will lead to foot drop? This is going to lead to foot drop because of the involvement of the common peroneal nerve, which is binding around the neck of fibula. The shaft of femur fracture. There is a 𝗪𝗺 PNR जिसका mnemonic हमने बनाया 𝗪𝗺 का. Remember, P for petechial rash, N for neurological abnormalities, R for respiratory distress. And person can die also, that we have talked already, sir. Okay, that we have already talked. Okay, chal. Now coming neck of femur fracture, intratruncatic extra neck of femur fracture, and this needs a open reduction. नेल्स, प्लेट्स एटसेट्रा लगा के इसको जोड़ना पड़ता है. देन कमिंग टू सॉल्टर-हैरिस क्लासिफिकेशन. नाउ आज सम 23 fractures I have taught you. I'll ask you some questions from the fracture, sir. Sir, distal end of radius fracture with radio-ulnar joint dislocation. With radio-ulnar joint dislocation. With radio-ulnar joint dislocation. What I am talking about? This is Galeazzi fracture. Next is, sir, first metacarpal bone getting fracture with multiple fragments. Multiple fragments of the bone is there. Which fracture is this, sir? रोलैंडो. और अगर एक ही सेगमेंट हुआ तो क्या बोलोगे सर इसको? बेनेट्स फ्रैक्चर. वेरी वेरी गुड सर. सर, lateral condyle of tibial fracture is lateral condyle of tibia, यार tibia, bumper fracture. Let's talk about this Salter-Harris classification now. सर, ग्रोथ प्लेट क्या हो गई? जुदा. फिर ग्रोथ प्लेट के ऊपर फ्रैक्चर लाइन कहाँ है? अबव द ग्रोथ प्लेट. फिर ग्रोथ प्लेट के नीचे फिर क्या हो गया? थ्रू द ग्रोथ प्लेट, ऊपर नीचे. फिर दूरियां मिट गई, दैट इज इरेजर ऑफ द ग्रोथ प्लेट. लेट्स टॉक अबाउट राइट हेयर सर. डिफॉर्मिटीज, जेनुवेरम एंड जेनुवेल्गस. जेनुवेरम, जिनु किसको बोलते हैं? टांगों को, घुटनों को. हिप को क्या बोलते हैं? कॉक्सा. एल्बो को बोलते हैं क्यूबिटस. लेट्स फर्स्ट टॉक अबाउट द जेनु. तो जेनुवेरस का मतलब क्या है? बीच में रास्ता प्रेजेंट है. जेनुवेरस मतलब रास्ता प्रेजेंट है. रास्ता प्रेजेंट है अगर जेनुवेरस के बीच में रास्ता प्रेजेंट है तो दिस इज लुकिंग लाइक अ ओ. ओ के साथ में ए लगा दो. ऑस्टियोआर्थराइटिस. जेनुवेरस इज सीन इन ऑस्टियोआर्थराइटिस. देन सर, नॉक नीज. नॉक नीज. नॉक नीज इज जेनुवेल्गम. गम मतलब गम की तरह चिपक गया, चिपने का हुआ. नाउ दिस इज लुकिंग लाइक अ R. So this condition is associated with rheumatoid arthritis. This condition is associated with rheumatoid arthritis. Rheumatoid arthritis. Then sir, cubitus is, if it is making L, this is valgus, cubitus valgus. If it is joined toward like this, creating some space, it is varus. This is varus. Then coxa angle is also equally important. So normal coxa angle is 120 to 135. If it is lamba angle, long angle, it is coxa valga. Chota angle, coxa vera. Coxa vera. Coxa vera. Now swan neck deformity versus the Botnier's deformity. Sir, swan neck deformity, remember what is happening in the swan neck deformity? There is a PIP and there is a DIP. PIP पे फ्लेक्शन और DIP पे एक्सटेंशन. DIP पे no. This is Botnier's deformity. This is swan neck deformity. This one. This is swan neck deformity. PIP पे hyper extension and DIP पे flexion हो रहा है. Opposite will happen on to the Botnier's deformity. They both are seen in the rheumatoid arthritis. They both are seen in the rheumatoid arthritis. My dear ladies and gentlemen. Now wind sweep deformity, it is seen in rheumatoid arthritis plus rickets. You can very well see because of the demineralization, or you can see the loose bone. The bone is, person is not able to stand straight. There will be deformity like this. This is called as wind sweep deformities. Chali chali fir chali 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 ishq di hawa chali. Now pencil and cup deformity, my dear. Pencil and cup deformity. Remember, it is seen in psoriatic arthritis. You can see ऐसा लग रहा है जैसे ये रहा पेंसिल और ये रहा कप, ये रही पेंसिल, ये रहा कप. ऐसा डिफॉर्मिटी यहाँ पे देखने मिल रहा है. दिस इज सीन इन सोरियाटिक आर्थराइटिस. सोरियाटिक आर्थराइटिस सर. देन कमिंग ऑन टू द पायोजेनिक. मोस्ट कॉमन ऑर्गेनिज्म स्ट्रेप्टोकोकस ऑरियस एंड मोस्ट कॉमन जॉइंट इन्वॉल्व इज नी जॉइंट. नाउ डिफरेंट टाइप ऑफ स्प्लिंट्स वी हैव टू टॉक अबाउट. Different type of splints we have to talk about, sir. Chalo. Now splint is used, this Thomas splint is used in femur fracture. Yes. Dennis Brown splint is used in CTEV, that is congenital talipes equinovarus, where your talus bone is standing like this rather than this. Club foot is associated with, कौन सा वाला होता है भाई क्लब फुट के अंदर? कौन सी ट्राइसोमी होती है? कैन यू टेल मी क्लब फुट में कौन सी ट्राइसोमी होती है? दैट इज गोइंग टू बी योर एग्जाम क्वेश्चन माय डियर फ्रेंड्स. That is going to be your exam question, my dear friends. Club foot. Yes, my dear friend. Yes, my dear ladies and gentlemen. Very good. Very nice. Wonderful. Perfect. Wonderful. Perfect. That is going to be the club foot is 13. Edward is 18. Very good. Mermaid splint used in rickets plus treatment of knock knees. Knock knees के treatment में काम आते. Cock-up splint used in the radial nerve injury. You will see the spring right here. Knuckle bender used in the ulnar nerve injury. Aeroplane splint is used in the brachial plexus injury. And so Taylor splint is used for the posture correction. What postural abnormalities we can have? It is your 𝗖𝗵𝗆 and lordosis. इसको correct करने के लिए Taylor brace we use, Taylor splint we use. Milwaukee brace is for the scoliosis. If your spine become S shape like this, to correct it, we use a Milwaukee's brace. Milwaukee. Bohler-Brown. Again, this splint is a common splint used to immobilize and reduce the lower limb fracture. For the common lower limb fracture. I'll ask you question and you will answer me, sir. The question number 1. Brachial plexus injury, which splint is used? Sir, aeroplane splint. Sir, lower limb fractures, the most common splint we are using is Thompson splint. Sir, ulnar nerve injury, which splint we are using, sir? Ulnar nerve injury, which splint we are using, sir? Ulnar nerve injury, we are going to use the knuckle bender. Let's now talk about the tractions. This gallows traction or Bryan's traction is used for the shaft of femur fracture. Okay. Russell traction is used for the truncatic fracture. Dunlop traction, we were talking about supracondylar fracture of the humerus. Can you tell me supracondylar fracture of the humerus will lead to a delayed complication, and what was that? Supracondylar fracture of a humerus will lead to a delayed complication, and what was that, my dear ladies and gentlemen? Supracondylar fracture of a humerus will lead to complication, delayed complication. What is that? Just a simple answer to a simple question, sir. And that is going to be your gun-stock deformity. Gun-stock deformity. My dear friends, coming on to the last topic, that is tumors. The second last topic actually, tumors. Osteodysplasty is a most common benign tumor of the bone. Proximal femur is most commonly getting involved. Okay. Second things, remember, giant cell tumor. This is also called as osteoclastoma. Okay. Giant cell tumor, GCT, lytic lesion without sclerotic margins. They are forming a soap bubble type of appearance, and the area they are involving is the epiphyseal area. Epiphyseal area. Treatment is excision plus bone grafting. Aneurysmal bone cyst. When a bone is covered with a cyst, my dear friend, this is aneurysmal bone cyst. 𝗖𝗵 sarcoma, onion peel appearance you will see, sir. This is 𝗖𝗵 sarcoma. And sir, sunburst appearance or Codman triangle because of the periosteal reaction you are going to see in the osteosarcoma. And osteochondroma is a benign tumor, originate from the metaphysis, sir. Then coming to the enchondroma. Enchondroma, if it is a tumor of the hand originating from the cartilaginous part. If multiple enchondromas are there, this is called as Ollier syndrome. Ollier syndrome. Okay, sir. Now I'll ask some questions and you will answer me, sir. Again, sir. Let's ask question. Question number 1. Onion peel appearance is seen in 𝗖𝗵 sarcoma. Sir, Codman triangle. Codman triangle is seen in osteosarcoma. Sir, benign tumor of the bone originating from the metaphysis is chondroma. Very good, sir. The tumor which is originating from the cartilaginous part is a tumor which is originating from the cartilaginous part is enchondroma. Multiple enchondromas are seen in Ollier's disease. Now let's talk about this gout and pseudo gout, my dear friends. I will be able to fix it like this. Yes. Let's talk about the gout and pseudo gout. Sir, if we talk about the gout, the location is very important. That is first metatarsophalangeal joint. In the pseudo gout, it is going to happen most commonly on the knee joint. Sir, in the gout, the crystal deposited are monosodium urate, which are needle-shaped crystals. And in the pseudo gout, there are the rhomboid-shaped crystal. Sir, on polarized light, the gout is sounding like a doubt, and having doubt is a negative thing. That is why remember negative bipharynges. Negative bipharynges. Acute gout treatment is NSAIDs, except aspirin and your PCM. ठीक है, वो granulocytosis वहाँ पे कराती है. Now, what about the chronic gout? Can you tell me treatment of chronic gout? Mostly asked question. The acute में NSAID देने हैं, chronic में क्या देना है? Allopurinol, xanthine oxidase inhibitor. Very good. Now, pseudo gout, you can see pseudo gout. Most commonly, you will see the knee joint, calcium pyrophosphate rhomboid crystal. P for pseudo gout, P for positive bipharynges, and treatment is NSAID. Osteoarthritis versus rheumatoid arthritis. Sir, rheumatoid arthritis is an inflammatory disease. Rheumatoid arthritis is an inflammatory disease, and osteoarthritis is a degenerative disease. Osteoarthritis is a degenerative disease. Most commonly, the bone involved is joint involved is a knee joint, my dear friend. Most common site involved is a medial site, my dear friends. Then rheumatoid arthritis, morning stiffness, etc. the patient is complaining of. With this, we have completed our 5th subject, and that was our orthopedics.